Medicaid is an enormous program where states are just proprietors. And I think
with the vulnerability of these particular populations, that the other steps are inadequate.
Your Honor, there's two aspects to your question, and I'd like to speak to both of them. One is the issue of whether we're just proprietors. We are not just proprietors. And I think the court effectively discussed that in NFIB versus Sebelius. Medicaid is an enormous program where states are contracted with the federal government, not providers. The providers are contracted with the states. So it is important, I think, to keep that distinction between these two programs. To your question about the dividing line, the dividing line here is precisely why we are in a major questions doctrine land, because they have never done this for at least since the Jacobson case. And before that, predominantly, this has been a question protecting the health and safety of individuals and exercising this kind of power to force the individual to submit to a medical treatment has never, ever been something that has been authorized by Congress or done by an agency on an emergency basis.
Counsel, I don't mean to interrupt you, but we've never had a situation like this one before. It's unprecedented.
But I don't think in this case that justifies them co-opting a quintessential state police power. In fact, the opposite is true. It only points up the need to evaluate this in the larger context of whether Congress didn't do this, by the way. The Congress, just as recently as last summer, changed some of the discrete statutes specifically related to skilled nursing and nursing homes and authorized certain measures for strike teams to augment staff in those facilities due to COVID outbreaks, but they didn't authorize vaccines. So for staff, I think there are cues. There are cues in the statute. There are cues in the history and structure and the precedents of this court that support waiting and maintaining the status quo as the district court below did and the Fifth Circuit did.
Justice Thomas, anything further? Justice Breyer? Justice Alito? Anything further, Justice Sotomayor?
I just want to say the Sixth Circuit didn't, correct?
The Sixth Circuit in the OSHA case
I'm sorry, I
operated differently.
Yes.
Yes.
Justice Kagan? Justice Gorsuch? Kavanaugh? Justice Barrett? Okay. Thank you, counsel. Rebuttal, Mr. Fletcher?
Thank you, Mr. Chief Justice. Just 3 quick points. I'd like to start with the interpretation of the statutes before you that the other side is offering, because I don't hear them to contest that the Secretary's authority to set conditions for participating in the federal Medicare and Medicaid programs includes the authority to protect patient health and safety, even in the statutes that don't include that language. I don't hear them to be disputing that the Secretary can adopt infection control mechanisms or require people to wear gloves or do other things of that nature. Instead, their submission seems to be that vaccines are different. And I think the problem with that is that they haven't really given you a basis to ground that in the statute. The first thing that they've said is vaccination is typically the prerogative of the states. And of course, that's true in some sense, but we're talking here about a federal spending program. And the regulation of medicine is typically the prerogative of the states. Usually it's the states who require hospitals to make sure their employees wear gloves or they follow the fire code or they have sprinklers, things like that. But no one disputes that Congress has given the Secretary the authority to make sure that providers who are providing care under the aegis of the federal Medicare and Medicaid program live up to standards set by the Secretary. That's what the Secretary has done here. The other thing that I've heard them say about why vaccines are different is that you can't take them off, that vaccines are somehow different than gloves or other safety measures, and so some special specific authorization ought to be required. And I just don't think that can be squared with the context of the healthcare industry. Vaccination requirements are common throughout our society. They're particularly common for healthcare workers. They've been adopted voluntarily by providers around the country. You have virtually the uniform view of the medical community telling you that this is the best way to protect patient health and safety. If anything, I think it would be bizarre to say that the Secretary's authority to protect the health and safety of Medicare and Medicaid patients does not include the authority to adopt a measure that you see other regulators adopting, the medical community urging, and other providers adopting voluntarily. The whole point of the statute is to let the Secretary make sure that the standards of care for Medicare and Medicaid patients meet best practices, and that's what he's done here. The second point I want to make, Justice Barrett, goes back to the colloquy that you and I had earlier about some of the different statutes. I hope we persuaded you that we're right about all of them, but in case we have not, I just want to make the case that it actually is worth the candle in this stay posture to go provision by provision. So as we explained, 97% of the employees affected by this regulation are covered by statutes that include the express health and safety language. Even if you just narrow it down beyond that, three categories, the largest three categories of providers, hospitals, home health agencies, and long-term care facilities, account for more than 90% of the covered workers. This is shown at the table at page 61,603. All of those provisions have express health and safety language of the sort that we've been discussing, and two of them, long-term care facilities or nursing homes and home health providers, actually include the extra provisions that we cite at page 6 of our reply that says the Secretary has not just the authority to ensure health and safety, but also the duty to do so. And I think at an absolute minimum, it's worth letting the rule go into effect as to them. And finally, Justice Breyer, I want to come back to a point that you've raised a few times about the equities because we are here on a stay. And I think a couple of observations to make about the equities. The first is a point that Justice Kavanaugh raised. You don't have providers before you here. You don't have workers before you here. Instead, providers and workers overwhelmingly support the vaccination requirement. Instead, you have before you states who do operate some facilities covered by the rule, but only a tiny fraction of them. The second thing I'd say is that even as to the providers and the workers who are covered by the regulation, some of my friends' presentation has suggested that if the stays are lifted, or if the preliminary injunctions are stayed and the rule goes into effect, that means that tomorrow people are going to be out of a job. And that is not true. The Secretary has put out guidance after the Fifth Circuit narrowed the previously nationwide injunction to cover only the plaintiff states here, put out guidance giving regulated entities 30 days to come into compliance as to the first shot, 60 days to come into the compliance as to the second shot, and making clear that even if a regulated entity has not met full compliance by that 60-day deadline, if the entity is at 90% compliance and has a plan to come into full compliance within 30 days, the Secretary won't take enforcement action. Even if that isn't met, even if at the end of 90 days there's still not full compliance, the Secretary has always exercised enforcement discretion before terminating a provider from the program, and one of the things the Secretary has considered is access to care issues of the sort that the other side has raised. So there are ways to address some of the problems that my friends have relied on, even if the rule goes into effect. On the other side of the ledger, and this is where I'll close, if the preliminary injunctions remain stayed, then we know what the consequence is. We know that this urgently needed measure is not going to be in effect to protect Medicare and Medicaid patients in half of the